Good morning, everyone, and let me introduce myself. My name is Dr. Phil, and I'm here on behalf of Elsevier to share with you some of my tips and tricks in getting the best possible marks in your medical school exams. So let me introduce a bit more about myself and give you a bit of my background for those of you that don't know me. I graduated with a triple first-class degree from Cambridge University in medicine and trained in my intern years in London and then working in medicine really before retraining in family medicine and now working as an educational supervisor for Leeds Medical School. I'm the editorial head for Elsevier's Clinical Key student assessment platform, which is a unique platform that uses the power of technology to bring a smarter way to conduct medical student assessments. I'm also the series editor and assessment editor for the Crash Course series of 14 medical textbooks, some of which I've put up here, which you may have seen as well. Now, I was invited last month to give a talk in the European Board of Medical Assessors on the future of medical school testing. So I keep up to the latest information of educational development around the world so I can give my students and you that edge. I love to try and find ways to make studying efficiently as possible so you can get the most marks in the least possible time spent revising. And this will be a series of interactive webinars where I hope to distill to you some of my knowledge and experience. Now, I'm going to give everyone here my top tips gleaned from years of experience, from research as well, on how not just to thrive in medical school, but thrive in your career and reach your fullest potential. Now, imagine I asked you to name 3 things that might restrict your success in exams. Post them in the chat right now, okay? Name me 3 things that's stopping you from succeeding in your exam right now. Phone, perfect. More, post more. I'll be looking at identifying and removing these obstacles that might be holding you back from achieving success. So post things up, procrastination, great. Let me know what's stopping you from succeeding in medical school. Let me know. Post in the chat so everyone can see. Distraction, insecurity, great. The advice I want to give you today will help you throughout medical school and life as a whole. So keep on posting, okay? Time management, vast quantity of information, insecurity, family issues, feeling overwhelmed, amount of syllables. Classic. What kind of things do you want to be free from to improve your success? Name me the 3 things. Backlog, vicious cycle, I agree. It's horrible, isn't it? Now, take a few seconds. Let's take a look at all things that we mentioned. Memory, focused, feeling overwhelmed, phone addiction is everywhere, isn't it? Okay? Self-doubt, distractions can summarize a lot of it. Anxiety can summarize a lot of that as well. Now, when we start talking about it as a group, we realize we're not alone. Not knowing where to start, Yusuf. Okay. Everyone has shackles they like to break free. And we also realize that those shackles are often the same for many of us. Just take a look at the chat. Everyone is facing the same problems. You're not unique. Everyone is on the same boat as you. And even for the people that might not have posted, they will agree with you that this is also the same issues that they face. Now, in this talk, we'll look at some of the most common issues that you have brought up that's holding you back and how to tackle them to improve your success in medical school exams. Everything that's been posted so far can be summarized really in nearly just one word: imposter syndrome. And that's a good one. I've often heard that. People often say, am I clever enough to be here? Am I clever enough to succeed? And I want to let you know that you are. A lot of people struggle with imposter syndrome. It's that feeling that you're not good enough, you don't belong in med school, and you're never going to make it despite all the evidence to the contrary. And it's obvious that this voice isn't reasonable and is not based on sound logic. Because after all, you made it into medical school. That in itself is evidence of the fact that you belong there. And for Hannah, the person that was going to medical school in year 0, you belong there too. But if you start listening to that voice and it starts eating away at your confidence, and worse, if you start focusing on the voice rather than improving your skills, eventually, I have to say, that voice can make you so scared of failure, you'll end up paralyzed, doing nothing at all. And often, the people who feel most this ways are high achievers, the perfectionists. And I know, and you know, all of you are high achievers here. That's why you're here today. So something you need to guard against. Everyone feels like an imposter sometimes, and that's okay. But what you want to ensure is that you don't let that feeling grow and overwhelm you. So you need a strategy that helps you ignore that voice and negative self-talk. Now, I'm going to share with you some of the most successful students I've ever mentored have a very positive mindset. They and you can achieve success by changing your mindset. Now, it's not an easy thing to do, but it's possible with some effort, which is actually what a growth mindset is about. Now, this mindset we've talked about is called a fixed mindset with imposter syndrome. A fixed mindset says things like failure is the limit of my abilities. But a growth mindset disagrees. A growth mindset will say failure is an opportunity to grow. You want to embrace a growth mindset. A growth mindset says that perfectionism is not attainable and is not even advisable. Failure is inevitable and not everlasting and is normal part of growth. Failure is not the end. It's just another part of the story, another rung on the ladder towards becoming who you're meant to be, which is a world-class doctor. And we learn by making mistakes. In fact, I'll let you know, studies show we actually learn more from our mistakes, except that you will make mistakes, but you can use those mistakes to grow faster, grow better. A growth mindset also allows you to acknowledge those areas where you aren't as strong as you'd like to be without fear, because a growth mindset knows these areas can be improved. Whereas a fixed mindset will say, I'm just not good at that. A growth mindset will say, I'm not good at that yet. Instead of thinking this is too hard, growth mindset will say this may take time and effort, but we will succeed. A growth mindset doesn't expect to accomplish everything all at once. Every little bit takes you further towards your goal. When you look at things with a growth mindset, you realize you can tackle anything. At the same time, you don't need to be overconfident. Confidence is great, but what you're aiming to be is competent. When you feel confident, you might feel you don't need to learn. You've mastered it already. When you feel competent, you feel you have the skills to do the job you need to do, but know that there's more to learn and will enable you to do your job better and better. So how can you develop a growth mindset? 3 things you can do. 1, admit your imperfections. 2, view failure as a chance to learn. And 3, add the word yet behind things you haven't mastered. A growth mindset also knows there is more than one path to your dreams. It's not about failure or non-failure. It's about continuous learning, growing, development. Your mind is not fixed. It's constantly improving and growing. And that's what is meant to happen, because let's face it, as a medical professional, you'll never stop learning. And I learn new things all the time because this is medicine. Some of you here have posted about procrastination, and that's so key. Everybody procrastinates. It's part of the human condition, and we procrastinate for many different reasons. We might find a task boring or difficult or frustrating. How many of you suddenly get the urge to clean your cupboard, your bedroom, when it's time to start studying? I certainly do. Procrastination isn't logical. Studying will help you achieve your goal of becoming a medical professional. So why would you procrastinate then? Well, the reason that procrastination isn't logical is because it's not logical on a neurological level. When you procrastinate, there's a fight going on in your brain because of your emotional limbic system and your logical prefrontal cortex. Your emotional brain is doing its best to resist for whatever reason that the logical brain knows is best for you. Now, the moment you choose social media or another episode of Netflix, your emotional brain is winning. And it seems the higher the stakes, the harder it is to resist. Right now, procrastination is not what you need in your life. The stakes are high, which is perhaps why your emotional brain is hanging on to social media, your phone, Netflix for dear life. But there are things your brain can take gentle control. I'm going to outline 4 things you can do. So number 1, do something small or easy or anything to get you started, right? I think of this as having 2 sides to your brain reaching a truce. It's not too much for your emotional brain to deal with, but it's good progress for you to kickstart, which will make your logical brain feel good. Now, for myself, I used the Pomodoro technique. I set a timer for 10 minutes, and I promised myself after 10 minutes of any activity, such as writing a talk, doing some homework, or marking some notes, I will stop. But I'll be honest, by 10 minutes, I'm actually so engrossed into the task that I have ignored for so long, I often continue to smash through it. Use it, try it. Number 2, plan your study schedule in chunks. Now, it's easier to start something that has an end and isn't stretching infinitely into the future. For example, let's read this chapter or the whole book of medicine. It's very difficult. But if you say, I will only read 3 or 4 pages of this, and then give yourself a reward when you stick to your schedule and then complete all the tasks you've set yourself, then it makes life a lot easier. And I tend to reward myself with a break, or I say to myself, if I complete, for example, 3 or 4 pages of a really difficult book or activity, then I'll go out to get myself a particular book that I've been eyeing up on to read for pleasure. Focus on your goals. That's number 3. Make a list of what is at stake and place it somewhere so you can see it in a daily manner if you need to. Remind yourself of why you're not going to procrastinate. Now, studies have shown that physically writing down your goals increases your chance of success. Writing down, I'm working on becoming a medical professional today, on your fridge, or better still, a post-it note and next to your phone, or on your phone, or on top of your computer. Choose positive statements and focus on the goal that you want to achieve is going to be so key in all of this. And number 4, some of you mentioned about your phone addiction. Put your phone somewhere far away from you, because phones are a big distraction, and distractions are something you can do without. This is such an important topic. Well, I'm going to talk more about it in the next section. Okay, so how many of you are guilty of multitasking? It's understandable. You've got a lot on your plate. So you might be texting your friends while studying, you might be on Facebook, you might be on social media, you might be seeing what's happening on your favorite celebrity. You're smart. You think you can do more than one thing at a time, right? Wrong. Now, we're not talking about work-life balance here. You want to be doing multiple things. You want to have hobbies, watch movies, see your friends. It's not about studying all the time, but what you don't want to be doing is doing everything at the same time. Now, if you're studying and you get a notification on your phone, you might think it only takes 10 seconds to look at it. But each time it interrupts your thought, it takes much more than 10 seconds to get back on track. The amount of work you could have done without that distraction is exponentially higher than the work you could do with that distraction itself. This is what we call classical context switching, when you cognitively are engaged with studying but has to switch to another medium and then switch back again repeatedly. And studies have shown that constant interruptions by notifications, even when you don't respond to them, reduces productivity by 40% over the course of a day. And that is time simply as a med student that you don't have at this moment in time. In addition to reducing your focus, concentration, and productivity, notifications will increase your anxiety levels. And we mentioned about anxiety before here. Non-stop alerts in this day and age, in the constant on world that we live in, whether they're from friends or news alerts, can leave you feeling very much out of control. Now, you can take control of your time by switching notifications on your phone off while you study. Switch your phone to mute, putting your phone somewhere entirely, completely, another room. Now, I'm not saying you should ignore your phone for the entire day. That's not the case. The idea is to compartmentalize. Have slots in the day where you look at your phone and respond to messages. Have slots where you look at emails or catch up on news. Choose the times that work for you. You are in charge of your own attention. Now, you want to choose when you want to pay attention to messages and when. You can control the distractions. You don't let them control you. Now, you'll be surprised at the sense of control you'll feel, and how much more productive you become by performing this very simple action. For me, I try to leave a certain few hours of the day without distractions entirely. No meetings, no emails, no phone, nothing. So that way I can concentrate on things with focus without the need to context switch. I find that I'm much more productive, and I also retain a lot more information. Okay. Another fun way to avoid distractions is to work in groups. For some, it may work. For some other people, it doesn't work. But what I find between successful students is that often they find or form a group, say on Facebook, and they organize what's known as a fishbowl activity. Let me explain to you. A fishbowl activity is when groups of people take turns participating in a discussion whilst onlookers observe, and you switch it out to let others who are observing take a turn. Now, in some versions, you deliberately choose different perspectives to argue a point, whether you agree with that angle or not. It can be actually quite powerful to look at an issue or trying to explain some physiological parameter from multiple perspectives and argue from that perspective itself. The added benefit is that it encourages your analytical brain to work harder, making it much easier to ignore distractions. The simple process of explaining and listening to other people's point of view is a great way to learn. And often spending an hour doing an exercise like this is worth hours of just working alone through questions. Can really show up any learning needs or gaps in your own knowledge. Now, think study space. Okay, if you're not organized already, now is a really good time to spend a bit of a time now establishing a comfortable and relatively quiet area to study in. Okay, if you can, set up a desk in your bedroom with all your resources organized around you in a pleasant atmosphere, or even better still, work in a separate room entirely. Now, I try to separate work areas so that when I enter a room to work, my brain is already engaged in work mode, okay? And is cognitively assigned to work as soon as I step through the door. Whereas, for example, if I want to sleep or nap, I go to the bedroom and I don't do any work in the bedroom. So I can cognitively switch off entirely and disassociate myself from work. That may be relevant to you or it may not be. You may have the ability to do that or you may not have. But you should associate yourself, for example, with the desk and then move on to the bed that might be behind you to sleep. Separate it out if you can. Some of you have mentioned before, vicious cycle, burnout, emotional anxiety. It's not uncommon for students to feel burnt out, especially when it comes to exam time. Students can feel the pressure from their teachers, their lecturers, their parents. They can feel the pressure that they themselves have put on them. And burnout isn't good. Much poorer performance, lowered motivation can worsen mental health. This is why it's important to find and keep balance in your life. I'm going to highlight some very basic things you can and should do to mitigate against this. Okay, so take a break. Take a break, even if they're a very short break. Take a walk, have some lunch, and focus not on your phone, not on looking at notes. Focus just on eating. Make time for exercise and hobbies and sports. Try to do things that take away from your computer screen or your books. And this is even more important at nighttime because a break from the screen for a while before you go to bed improves the quality of your sleep. And getting good quality sleep is really, really valuable for you right now. You might be a med student, but that's not your whole life. You want to keep some balance. And I try to take a break if I can every hour, which lets me cognitively deload and reset. This helps me, and I hope it may help you too. Okay? And I agree, Yusuf, because of everything that's happening online with online education, expectations from students, from teachers, unreal. I agree. Now, you might be thinking right now that this sounds impossible with the workload, which is why the solution is to spread your work over time. This makes it possible to study effectively while maintaining a balance in your life. Now, when it comes to achieving your goals, one of your strongest assets is a plan that will help you achieve the best possible outcome. Now, remember to have a growth mindset when you come to the plan. Everything will not go according to plan, as we see in the bottom picture here. But that's not the aim. The aim is to have a plan to work towards. When you need to, you adjust the plan. What a plan will help is to break your workload into achievable chunks and give you control over your time. Of course, everyone looks back and thinks, oh, I should have done work sooner. Forget about it. Plan to spread the work over time you have left starting now. Plan some breaks. You'll need them. Now, think about fresh food. Think about proteins and oats to give you slow digested sugars so you do not suffer from a glucose crash halfway through either the exam or a revision session. Get some fresh air as well. Get enough sleep before an exam to allow your body and brain to perform at their best so you can really hit the ground running. All are very, very important. But I'm going to tell you now, the most important of them all is flow, okay? And that's one of the last slides before we go into Q&A. So if you have got any questions for all the slides before, then post them into the Q&A section before, so for Debbie to triage and for me to answer for you as well, okay? Find your flow. I want to let you into a little secret, okay? With you sitting at home or in the library, do you have a time when you felt that everything went right, okay? Where you walked out of an exam and said, I nailed it? or when you were playing football or cricket and you were able to hit the ball perfectly and you had the perfect match, or where if you played musical instruments, whether it's piano or something like that, you went to a recital and managed to hit all the notes perfectly, spot on. You've been in the zone. Sportsmen and sportswomen, they really desire it. And performers and singers, they really, really want it as well. And I have to say, as students and as educators, we need it. We really want to achieve this specific mental state of flow. And what we really want to do, we want to achieve the state before exams, and we want to achieve the state during revision sessions. A state of flow is when you're a state of heightened excitement, where you're able to manage your anxiety, your stress. You are a little bit anxious, you're a little bit stressed, and stress is good for you, but it doesn't control you. So you have heightened excitement instead. And where your own skill level matches that of a challenge level of the exam or the revision session, or any topic that you're trying to get your head around. And where you find that the exam is fun and an inquisitive challenge. Now, as opposed to a stressful, worrying assessment that will determine your future, that is when you perform at your peak. That is when you find flow. I will be honest, of all the thousands of students I've taught and mentored, those who can find flow in an exam setting and those who see or think of exams as challenges rather than assessment, those are the successful ones, both in medical school success and also in life success. Now, I've gone through some advice how we could find flow in the last couple of slides. I want to explore specifically on flow in next week's webinar through using my 3P technique. We don't have the full time for us to go through this right now, okay? But I'm going to be focusing on flow and how to tackle exam questions in next week's webinar when you come. So for now, we're going to go into Q&A with Debbie, if that's okay. So for now, if you've got any questions that you have, then please post them under Q&A and we will go through some of the questions. Any questions that you have, please post them in the Q&A box. Okay, good. So Hannah, Pomodoro app, yeah, good. You can grow that. Very useful. Now, I'll be honest, a lot of people ask me, Phil, what app do you use? Or how do you, what sort of technique, what's your technology stack that you use to do whatever that you're doing you're trying to focus or techniques or learning skills or study apps? And I have to say, it's not about the app itself. It's about the person. It's about your technique. You can use a timer. You can use an old school clock. You can use whatever it is you want. You don't have to use an app. And it's not as if one app will be better than the other. It may suit you better, and of course you should explore and use it. It's about being consistent and utilizing it to the best extent possible. And again, it's a mental mindset. Don't ever think, I need this app to succeed in life. Don't think that. Think, I need to learn this technique so that I can achieve better. So Shubham, perfect. Put it into the Q&A box and I'll answer them for you here. Okay. I've got the Q&A box now, and let's go through the questions. What's the best way from Devrakran? What's the best way to extract and remember information from textbooks, given the vast quantity of information required for examinations? Good question. Very good question, Devrakran. Now, you can go through Study Skills webinar that I did last month to see some specific techniques, but I will tell you what I do to tackle this. I have lecture notes. I have a massive textbook of, say, cardiology. And what I do is this. I have a patient that I remember from seeing clinically of what their vision is, of what they look like. And I put structured information on that scaffold, okay? So I have someone with atrial fibrillation, right? I remember seeing them in clinic. I remember seeing them in a ward round. And then I remember their face. I may even remember the name. And then attached to their face, that mental picture, I then take information from textbooks and attach it to them. And so by the end of the revision session or even coming to exam, I can say, great, so I'm talking about atrial fibrillation and I can remember even the patient's face in front of me, and I can vividly imagine all the management, everything that I need to have. How to extract information is so important because you have such a vast quantity of information, don't you? I mean, I'm the series editor for Crash Course books, and these are very succinct, high-yield books. You'll have textbooks with a lot of information. Some of the information you don't need. You want to be succinct. These are the information that will be needed for clinical practice. These are the information that's needed for your exams. Just focus on that. And the way I do it is I read through the textbook first. I then shut the textbook, and then I try and regurgitate that particular issue. For example, atrial fibrillation. I try and write down everything I can remember on it in a blank sheet of paper. And then I scaffold that around a clinical scenario in my head. Then I leave it maybe 2 days, 3 days, and then I bring a new sheet of paper, blank, and then I try and see whether I can, again, get atrial fibrillation out on the paper, management, investigations, clinical presentation, everything on the piece of paper. And then I compare between my first original scaffold pieces of work that I've done straight after the revision session, and then I go back to the textbook and see what bits are missing. I use a red pen, and then I write down, highlight things that are missing, and I keep that in a folder, and I can track that. And using spaced repetition, I can normally do it 3-4 times, and it's in my brain, and it's in my brain for good. As long as you find your flow, as long as you focus, and as long as you hit the spaced repetition timeline perfectly, which you can take a look at the previous webinar. Once you've done that, eventually I can use the word atrial fibrillation, and I can imagine everything in my brain already without even having to write it down. And in terms of revision, I don't even need to write it down. I can just say the word atrial fibrillation, 4 or 5 key buzzwords or focus keywords, and I can extract all the information out. So that's how I remember, and that's how a lot of my successful students do it. Okay, another question. What would you recommend for a student out of USA but wants to take USMLE, who don't have much money because of currency? Is very, very difficult, okay? One thing I would suggest is the fact that you can still achieve it. You don't need to be in the US. You don't need to do all these fancy courses that's out there at the minute, which cost hundreds or thousands of dollars. What you need to do is to be focused on the USMLE questions that come up, that occur frequently, focused on the topics that will come up most frequently, and also focus on the management, as well as to be able to comprehend and be smart with your exam techniques. And that is going to be the key. If you want to succeed, then you need to utilize your resources to the max. And that is using resources that's available to you or available freely through your lecture notes. I have known, and I have spoken to students who are from India, who are from elsewhere, and from Africa, who don't have much resources at all, but who are now in Harvard Medical School lecturing. The work at Brigham and Young, they are residents, they're now attendings there, and they've started from nowhere, and they've got there not because of money, not because of resources, but because of dedication, because of the way. And they are hungry. They're hungry to be there. They want to be there. They want to be there more than someone else that's based in the US is there right now. And that's how they got there. And I'll show you how to tackle exam techniques in the next webinar. Okay, how do I remember the material I study to be able to produce it during exams? Very difficult question. Quandro, if you look at the study skills seminar I did last month, I will tell you in terms of how to remember, basically, and it's very, very tricky, but that has a really good way for you to link back, and we'll send the URL to you in terms of how to do spaced repetition, how to help with memories too. Okay, now, how can I motivate myself from NADA? Very good question. How do you motivate myself? Well, how do you motivate yourself? You need to use crutches, and I use different crutches. I wake up, I look at my to-do list, and I say to myself, why do I wake up in the morning? Why do I wake up in the morning? Why do I want to go to work? Why am I doing this webinar? What am I wanting to do? What do I want to achieve in my life? Have a plan. What do you want to do at the end of the year? Where do you see yourself? What do you want to do in 3 years' time, 5 years' time? Once you have those written down in terms of a plan, put it board in terms of a vision board, and then you can easily motivate yourself, because you will say to yourself, right, I could watch another episode of Netflix. I could spend 10 minutes, 20 minutes of my time looking at Facebook and going through all my friends' pictures. Or I can see my vision board and say that if I succeed in my exam, and by succeeding in my exam, I need to do this piece of coursework, and to do this coursework well, I need to do this revision and look at this library and read this particular topic. If I do that, then I will succeed, both for your 1-year plan, both for exams, 3 years and 5 years. Once you've convinced yourself that, and it's all mental mindset, then you will succeed, and then you'll be able to motivate yourself. Motivation can be intrinsic. Motivation can be extrinsic. What works for you, you need to try and find out. But I will tell you now, of all the students I've seen so far, intrinsic motivation, what motivates yourself, is the most important. Extrinsic motivation, doing something to get an award, doing something to get high marks, doing something to please other people. These extrinsic motivation factors, very short term. And once you lose that dopamine hit of extrinsic feedback, your motivation wanes rapidly. Whereas the intrinsic motivation, even if you have setbacks, with a growth mindset, you will succeed. And you'll be able to motivate yourself to do things, not just with medical school, but everything you want with life. Okay, another question. We have problems getting started, but once started, I blow it out of the water. Any tips for getting started other than 10-minute method? Right, very good question. Now, getting started is the main problem. How do you get started? 10-minute method is the one that works for me. Getting yourself timetable to say, in the next hour, I want to do this, schedule. And you want to be held accountable for it. So you will you want to post to your friends group and say, right, by the end of this week, I'm going to finish all of cardiology by reading a chapter a day in the next 5 or 6 days. Number one, you have accountability. Number two, you've outlined your plans. Number three, jot down the plans to other peer groups, not just to yourself. Pin it somewhere. Number four, have intrinsic and extrinsic motivation to try and kickstart things. And number five, use the 10-minute technique to really kickstart. If your problem is kickstarting things, use the 10-minute technique. Honestly, it will change your life. It changed mine, and it changed the life of other students that have used it. It's simple. You don't need it to be complicated. In life, simple things work, and simple things you will stick to, and simple things you will use day in, day out, and that's what's going to work for you. Okay, what do you do when you're very tired and still have a lot left to study for an exam? Shreya, if you're very, very tired, you need to stop studying. Take a break. There's no point studying 5 hours, 10 hours, 20 hours if you cannot physically sustain that level of mental alertness, and because you will just be wasting time. You just won't be able to retain that information. And that's a very good question. If I'm tired and I see myself, goodness me, I've still got another 50 hours worth of work left, but I only have 40 hours of time left in the day, what do? I focus. I take a break, I have a cup of tea, and I work out, what do I need to know? What do I really need to know? What is high yield? What is the things that I really, really need to know versus what is things that are good to know? And that is the important thing. No medical doctor knows everything in life, okay? They are niche specialists. They may know a lot about a very deep area. For medical student, that may be also true. You may have to focus on exam technique, to focus on what area of the curriculum you want to focus on that may come up more frequently. So for example, I have 2 students. One will work 200 hours and will try and cover the whole curriculum. The other will just do 50 hours and will get the same mark as the other person who spent 200 hours on the curriculum, because they are hyper-focused on the exams. They're hyper-focused on what's going to make a difference rather than the fine minutiae and then forgetting everything anyway in a couple of weeks' time. And that's what's important here. Okay, do you recommend using Anki or other spaced repetition software for studying? Arnold, good question. I personally use Anki, but other people don't have to use Anki. You don't have to get very technological. You can literally just use a piece of paper. And honestly, when I was in medical school, when I was in Cambridge Medical School, all I had was a blank sheet of paper. And that is what's been taught to me. I was taught by one of the world's leading physiologists who was about 85, if not closer to 90. And he just gave me a blank sheet of paper and said, Phil, write down everything you know about atrial fibrillation. I wrote it down. He took a red pen, marked it and said, revise it, the area that's in red, and then do it again in a week's time. Put it in the folder. And that's what I did, week in, week out. And that in itself, manual method with a blank sheet of paper, was enough. You can use flashcards, you can use Anki, you can use anything that will help you, that will fit in with your technology stack. So if Anki does help you and you do have access to it, then please feel free to try it out and see how it works. Okay, Kumal, at time we feel a lot of anxiety, and at that time, even if we try, we cannot focus. So what can we do to tackle anxiety in that situation? Let me show you a technique. It's the 4-7-8 technique, okay? I've used it with my students. I use it sometimes on myself. I use it with patients. When you are faced with a patient who is an asthmatic, who is having a panic attack, who is having an asthmatic attack right now in front of your eyes, and the saturation is dropping down to 80%, not because they have an asthma attack per se, but it's mental, it's physiological, it's actually all psychological there. You need to be able to control their breathing. You need to reset. And I will show you right now how I do this. I use the 4-7-8 technique. I'll expand. I want you, all of you at home right now, to follow me and follow my instructions. Take a deep breath in, okay? 4 seconds. Hold it for 7 seconds, okay? And after that, breathe out with a whoosh, in total 8 seconds. Let's do it together, okay? 4 seconds. Breathe out completely. So it's empty everything you learned. Breathe in, 4 seconds. 1, 2, 3, 4. Your chest is tight. Hold it for 7 seconds. And breathe out now, 8 seconds. 4, 7, 8. Okay? Breathe out. Empty the lungs. Breathe in 4 seconds, and then hold it in for another 7 seconds, and then breathe out, make a whooshing sound in total of 8 seconds. That is important. When I'm dealing with an asthmatic patient, it's called breathing the box. When I tell them to breathe out over 8 seconds, I tell them to imagine, make a whooshing sound and paint a box about 3 or 4 times. When they do that, that's about 8 seconds. Because they're so focused on their breathing, 4, 7, 8, 4, 7, 8. When they do that, it becomes cyclical. They overcome, they forget all their worries, they forget all their anxiety, and then they can focus. Once you are focused, once you overcome your anxiety, once you prevent that vicious cycle, then you can start overcoming things. So try it now, 4, 7, 8 technique. Okay, next question from Micah. How can I function well mentally with less sleep? It's hard to feel efficient without getting 8 hours of sleep for me. Hard to think clearly. How do I prepare myself to sleep less for future duties? Micah, that is a good question. I'm going to share with you an anecdote. Now, when I graduated medical school, I had some friends who were quite crazy. There was one friend in particular, I still remember him now to this day. And his reasoning was this: to prepare for his internship year, in the 2 to 3 weeks before starting internship, across the summer holidays, what he did was he slept for 2 hours a day. He said to me, the argument is he wants to be getting used to sleep 2-3 hours at a time, because that's what he's going to be having in intern years. Now, I'm not sure that's the right thing to say, but certainly that's what he did. And I felt that was a bit crazy, because people just do not perform that well when they're sleep deprived. When you're sleep deprived, when you don't have enough sleep, you will suffer cognitively. Even if you don't think you're suffering, you will be slower, you'll be more forgetful. So you do need to get enough sleep. Nothing should overcome sleep. If you need 8 hours, you need to set yourself a goal of 8 hours. You'll be doing yourself a disservice if you were doing less than 8 hours a night. What I did was I knew that I normally need 6 to 8 hours a night, and certainly I do run on coffee. And I do find that when I was in medical school, or when I have time of high stress, I do compress my sleep cycle. It's a lot less. But I also take naps. I take micro naps. So I drift off. I take less than 30 minutes, then I wake up. So what I normally do is this. I have a packed morning. I then say to myself, great, I'm going to take a nap. My nap is going to be 30 minutes. Any longer, then I'll hit my sleep cycle. And that's not going to be good, because I'll wake up groggy and feel sleepy, and it's going to be completely disruptive to the afternoon revision session. So what I'll do is I'll make some coffee. I'll drink the coffee. It's an espresso, 1 shot only. And caffeine normally takes about 30 minutes, 45 minutes to get into the bloodstream in terms of peaking by absorption. So it peaks at the right time. And then I'll lie down, fully clothed, on a bed. And I will clench. I'll clench and I'll close my eyes. I'll do the 4-7-8 breathing technique as well. And I will clench my feet. I'll clench moving up my calf. I tense it and then relax. Tense and then relax. Move up my thighs, and then I move up my arm. I clench and then I relax. Clench, and I really focus on each muscle now. And then I go up, and I just imagine all the stress, all the anxiety disappear. And before you know it, in about 5 minutes time, I get to sleep like this, not because I need the sleep, not because I'm sleep deprived, but because I'm in such a state of relaxation that I'm not even thinking of work. I'm not thinking of exams. I'm not thinking of anything. I'm not even thinking about I need to fall asleep. I'm just thinking about my breathing, about the tensing and the relaxing. I just naturally drift off to sleep. You need to try that. And then that 30-minute nap, that micro nap. And when I wake up, I set the alarm, I'm wide awake. Caffeine's in my system. I've rested. My memory is a lot better. I'm ready to hit the afternoon. And I'm so prepared. You should try that. If you think you need 8 hours, but you can't get away with 8 and just need the time, then be focused or try and do a midday nap if you can. It has affected me, it's changed my life, and it's worked very well, especially coming up to exam season when that is in itself very, very useful as well. Another thing to do is basically just do some exercise as well, high intensity exercise, get a shower, get a bath, and then try and hit the bed, and that way you can cognitively deload a lot quicker as well. But try the lunchtime nap session, especially the 4-7-8 breathing technique. It works for me, it's worked for a lot of people I mentored, and might work for you too. Okay, we have someone that posted, during this time we have online classes where we go through case studies. When doctors ask questions I cannot answer very well, what would you recommend I do to be better prepared? Okay, good question. Now, preparation is key. If they are asking you a question about knowledge, they might say, Phil, tell me about the different causes of atrial fibrillation. You may or may not know the answer. If you don't know the answer, you can either try and work it from first principles and say, well, I don't know the answer, but if this is similar to, say, ventricular tachycardia, then these could be the possible causes. Or you can work from first principles, say, physiologically, this is what I know, and it could be due to a disruption of, say, the conducting pathways of the heart. And so by theory, then it could be, for example, any scar tissue could be causing it. Could that be right? And expand upon that. If it's a knowledge-based one, try and don't say, I don't know. You want to say stuff like, and expand your repertoire to say, this is what I think is because of X, Y, Z. Now in Cambridge, we had a very Socratic method of teaching, okay? And I will share with you what happens. It'll just be me. I'm looking at the tutor in front of me. It's 1-to-1 or 1-to-2 students. There's no hiding away. He will look at me and say, Phil, tell me about the 10 causes of irregular heartbeat. I look at him, he looks at me, I look away, I look down, you can't avoid him. So you've got to answer it somehow. How you prepare yourself is different. After that method of teaching, it taught me that with preparation, I want to read around the case study. So if I know we're going to discuss about, say, atrial fibrillation, I want to read more about it. It's encouraged me to be inquisitive. It's encouraged me to say, do you know what? Even if I don't know now, sir, I will read it and I will get back to you next week and I will present to you what I know about atrial fibrillation. And that will keep the teachers and the doctors interested in your education. Because if you say you don't know, at the end of the day, they don't really care. It's your education, it's you yourself. Eventually, you'll have to go to a hospital and you'll have to manage someone with atrial fibrillation or an irregular heartbeat, and you need to be able to diagnose it yourself. So reading around the topic, being able to derive from first principles what could be related to that, or what could be happening, or if you don't know that, then try and say that you don't know and be honest, don't make things up, and say that you will read up on it and go back and present on it. If they're not there, then present it to the rest of your peers. That is probably the best advice I can give you. And if it's come to a situation where you think to yourself, gosh, he's been calling me and I don't know the answer to everything, then it may be a case where we need to address the learning needs. What is being asked, whether the questions are reasonable or whether they're asking very niche questions that no one knows the answer to, or it's something that's very sensible. What is the differential diagnosis of chest pain? And we should know this. We should know this as students, and we should know this as doctors, as your bread and butter. Once we know the question of that, then you'll be able to do better. The other thing is this, is performance anxiety. Sometimes you know the answer. Sometimes you read it, but when they ask you a question face to face, you just can't recall. And certainly that's what happens. If I was a good teacher, I would probably not say, tell me the 10 causes of irregular heartbeats. It shows a level of knowledge, level of memory, but it's very niche topic, I would normally want to couch and say, tell me, explain to me. And if they don't know, I want to have the opportunity to explain to them or get the peers to explain to them about irregular and irregular heartbeats. That makes a much better educational session than trying to direct it one at a time. So again, it's a mix. See how it works for you. Okay, how can we deal with a lot of thoughts about personal problems when we're studying? Anna, that is going to be an issue, especially during COVID. It's not just going to be during COVID. When you become a doctor, when all of you here become successful doctors, you will be seeing patients. But do you know what? You're not just a doctor. You're a human. You could be a parent. You could be a brother. You could be a sister. You could be a son. You could have issues in life, in relationships. There could be politics. There could be so many other things in life. How you deal with this, how also that it doesn't affect your working life, how it doesn't affect you managing a patient and making mistakes when you study is all about compartmentalization. And that's how I do it. Even a reverse is this. If I have a really bad day at work, or if I have a really, really bad day in the medical school and I'm trying to teach someone or trying to engage with someone and it's not really going in, I don't bring that home. I try not to bring it home. I try not to bring it to my kids, my wife. I don't do that. What I try to do is compartmentalize it. When I leave work, that is work. When I go home, that is home. And the same should apply to you. When you have life, that is life. When you go to study in the library, that is study in the library. And you can embrace life when you come out of it. If you blend the two together, it's going to lead to a worse outcome. How you separate the two is tricky. Different people work different ways. Often talking it out loud, talking the issue out with someone, your peers, your relatives, or a trusted tutor can often deload, de-stress, and tweak out all the main issues. I can't give you personal advice because I don't know about your situation, but feel free to reach out to me and feel free to reach out to us and see what we can do to help you. Okay, another question. Sometimes it's very difficult to resume the work. What can we do to maintain the rhythm? Rhythm is all about planning. It's all about workload. It's all about planning its schedule. Is to say, right, I've got 1 week. I want to master cardiology. I want to do these chapters. I want to do some questions as well. I want to read these specific books. Once you hit the work, once you say, I've started it, continue with it. Take frequent breaks. Reward yourself, maintain that intrinsic motivation that you're going to achieve and do better. If you can do that, and if you can do all of that, then that way it will make you a lot better in the longer run. Because what you don't want to do is try and start something off, get distracted, lose the rhythm, and forget everything and have to restart everything again. It demotivates you. Once it starts to demotivate you, once you do the stop, start again and again, then you lose impetus and nothing will work. So we need to cut it out. If you find yourself starting, start afresh. If you say to yourself, I just want to play computer games, play a computer game for 2 hours, and then start afresh with a plan. And that's what I've been trying to allude to with study skills last month, and that's what I've been doing with webinar this week. And next week, we'll be going through exam strategies itself. Okay, next question. So, okay, Abhinav, I don't have a question, but I have a confession. Okay, I'm here to listen to your confession. Elsevier had recently launched the Clinical Key National Challenge for Indian medical students. Perfect. Despite being a first-year med student, I could manage to reach the round 4. However, I failed to reach round 5, but that didn't actually demotivate me. In fact, it taught me about my mistakes and motivated me to participate in more such competitions. This was the first time I actually had this feeling, so thank you. This may sound really cheesy, but actually thank you. My pleasure. My pleasure. So Elsevier wants to do this for you, and we've recently done Clinical Key National Challenges for especially medical students to test your knowledge. And you are only in the first year, and yet you've reached round 5. Do you know what? That's good. That is kudos to you, okay? Abhinav, shout out to you internationally. That's kudos to you for reaching, finishing round 4, not yet round 5, but you're in year 1. That is amazing. That is the level of motivation, and that's motivating you to participate not just more, but also in the future participate in future competitions, but also participate in your interactions with your own teachers. That is important. However, I will caveat by saying that that's extrinsic motivation. If you don't succeed, the converse is don't think that Oh, do you know what? I've only reached round 4. I'm a failure. That's not the case. Use that as a jumping point to succeed and say, I now know what my weak areas is. And this, guys, is what I've been trying to say to a lot of people in the last couple of years. This is where research has been shown. Assessment, which is basically what the key National Indian Challenge is, assessment of medical students isn't now just assessment of learning, of assessing what you have learned, what you know, is assessment with learning or assessment as learning. So that means you're using the rounds, using the challenges, using the assessments that you have to use that with good feedback from your tutors or by yourself or with your peers to study more, to address your weakness, and then to succeed. That is where about positive growth mindset is. That is about finding flow. Okay, is it best to study day or night? Maria, that's a good question. It depends on what type of person you are. Are you a day person or you're a night person? And whether you have any distractions. Sometimes people have lectures, some people have nothing in the day, in which case they may work very well in the day. Sometimes people find that the night time after, say, 8 p.m., 9 p.m. is very quiet and you can focus 2-3 hours with no distractions. What works for you is important. What I did was this. I found out when my exams were. My exam are, for example, 1 p.m. So what I did was I studied and I revised and I did mock exams at 1 p.m. So that way, all the knowledge would peak, would have in the right context at around 1 p.m. So that way, when my body goes to the exam hall, it will also peak. It will also have that the physiological context of seeing those familiar topics at the right time frame. So it's not about studying or revising morning and evening time. It's about using it at the right time. As a doctor, you'll be using knowledge day and night. So it's regardless, you have to know the topic. Okay, another question. Maria, a doctor nowadays must cope with the use of network to be highly informed, reading research, studies in PubMed, Medscape, connecting in LinkedIn. All these infos could easily cause anxiety. What's your opinion? Okay, very good question. You do need to be connected. You do need to know what's happening. Okay, and that is true. You can be updated via research, but remember, is within the context. As a doctor, I recognize my limits. I recognize that I'm not an expert in all the different subjects. And COVID has put play to that. When COVID came, all these specialists, respiratory, ICU, in the first year, first 6 to 9 months of COVID, no one knew what they were doing. No one knew whether to do early intubation, late intubation. No one knew whether dexamethasone, prednisolone helped or didn't help. They could do trials, and trials did help, but a lot of it was through personal experience. And it was a really level playing field because we didn't know what was happening. But yet, doctors as a whole kept up to date with information, kept up to date with their peer groups, kept up to date with research on COVID, and then knowledge improved, and then technology improved, and then medicines came out. And these are the sort of things that you need to do both as a medical student and as a doctor. This is part of your life. Remember, medicine is not a 9 to 5. It's not just a job. It's a vocation. You live it, you breathe it. Even when I go home, I may have to keep on top of the news because it's relevant to me. And it's not because I see it as a job, because that would be very stressful. I can appreciate where you're coming from. But I see it as a fact that is part of my inquisitive nature to find out what's the latest, what's happening. Okay, Anastasia, how do you find a good method to study in medicine? That's a good question. I want to refer you, Anastasia, to my first earlier webinar last month, where we will send the URL out. It's been pre-recorded, where we had about a good number of students here also asking questions, and I went through study techniques. So how to study, I've already been through that before, but you can take a look at it in your own time from last month's webinar. How can you set yourself free from self-doubt and fear of errors and failure, Afnan? That's a good question. How do you set yourself free from self-doubt and fear of errors and failure? Let me give you a story, a sword of Damascus. There's a sword hanging up in front of all doctors. When they make a clinical mistake, oh, they may get sued. Oh, there's a fear of failure. Oh, there's a fear that I'm going to kill someone or patient will come to harm. And that sword of Damascus will hang above us in all forms for everyone. How you protect your head from that sword, how you feel as if what's going to manage your anxiety of making a mistake, that is important. I manage it by mitigating the risks of anxiety and self. And the way to do this, I say to this, right, this patient has atrial fibrillation. I will manage it using this. I could be wrong. It could be something else, in which case I will safety net and do this. As a student, you should say this. I have 3 months to do this before the exam. However, there is a chance that, for example, in 2 months' time, something might happen and I might be delayed for a month. And if I get delayed for a month, I don't have time to revise for everything. If I don't have time to revise for everything, then it gets really bad, because then my parents will be disappointed. I'll be disappointed. My teacher will be sad, and I'll feel like such a failure. Stop that. That is a negative mindset. Once this webinar is finished, scroll back to the first bit of the talk. I'm talking about positive mindset. I'm thinking, and you need to turn your fear of failure into a fear of success. You need to turn your fear of anxiety into, reduce that anxiety into heightened excitement instead. It's normal to have stress. It's normal to be anxious, but not so much it causes you to affect performance. Bring that down mentally through flow, which I will go through with you next week. And then once you control your emotions, you'll be able to overcome them. Once you overcome and control your emotions, you'll be able to take control of flow. Once you take control of flow, you will perform in exam, in school life, and also in life itself. Okay.
I feel it's Deb's here. I'm so sorry to interrupt. We're just about coming to the end of time. It's almost 2:30. We probably have time to just do one last question.
Okay. Fine, no problems. Okay, we'll do one final question, guys. I know that there's so many questions out there.
There's still lots coming
in. So keep on coming in with the questions, and I'll try and answer them in the next talk if I can cover them. If not, then obviously in the next webinar, obviously there's a Q&A session as well there. Okay, final question now. I'm wondering, how can I improve myself differently? Not just for my studies, but especially as a doctor. How can I look from different perspectives? That is a very mature outlook. That is the type of question that a person that wants to look from a different perspective is asking. You are introspective. You are self-reflective. You are reflecting on what is the other person thinking. You have empathy. That is the key differential between a good doctor and being an excellent doctor. That is the key differential between a friend and a good friend. Imagine if you're talking to a friend and the friend is saying, oh, do you know, I'm really feeling low, I'm really depressed because of XYZ. You're a friend, you nod your head, okay. But a really good friend, a really excellent friend, will be able to live in the moment and really feel and empathize with the other person and say, oh, I'm really sorry to hear that. And, you know, I can feel the pain that you're going through and really feel what the other person is going through. And what you're doing and what you're doing right now by going to these webinars, by trying to personalize yourself and improve yourself and trying to look at it from a different perspective is so key. The way I do it artificially is this. I go to a lot of Zoom meetings these days, and it's very difficult in conference calls and Zoom meetings for there to be a difference of opinion. And it's not very nice, because obviously it's very difficult to have, you know, it's not very easy to see body language between the different people. And if there's a disagreement, I really want to put myself into the other person's foot to see it from their point of view. And often there are a couple of phrases that I use. I often say things like, okay, I'm trying to see it from your point of view, and I'm thinking that this is what you're thinking. Is that right? And I can see that this is affecting you a great deal. And I just want to explore what you're thinking about here. And this is what you should be doing. If you can put yourself into the mindset, into what they're thinking, then you will succeed. And this is one of the key techniques I'm going to show you next week's webinar, putting yourself in the mindset of an examiner. Because if you know what the examiner is thinking, then you will have a rough idea what he wants to test you on, not just for medical school exam, but for your postgraduate exam as well. What question is going to happen? And once you have that, once you know that, then you'll be able to anticipate what things may come up, what things will come up, and you'll be able to succeed in life. So the techniques I will show you next week will help you both in your exams and also make you hopefully better as a doctor, physician, and as a person.